This is a fantastic drug, and I hope I can convince you to use it. I've been using it for about 10 years now. It was a part of a bit of my master's thesis in Nasa University. And then obviously when I came back, I was still using it. We do have a bit of a love and a hate relationship here, but it's more love. So I end up using it a lot more, and almost all my dogs do get this drug. So I hope I can convince you to use this more, and you will see why. So when I say I anesthetize patient, it is basically like a balanced anesthesia, right? So it is based on the 4 primary pillars of unconsciousness, analgesia, good muscle relaxation, and amnesia. Amnesia probably more important in humans than in dogs and cats, where you don't really want to remember the whole episode, but it has also been taken into consideration in the veterinary world now. So what does an ideal anesthetized patient look like? Okay, so obviously when a surgeon walks in, he likes to see a nicely unconscious dog or a cat, a very good muscle relaxation. So whenever they start with the surgery, they don't want any stiffness, they don't want any struggle when they're pulling on the ovaries. Maybe there's no pain at all. So whenever they're doing any painful procedure, maybe pulling on the ovaries, maybe extracting a tooth, maybe some orthopedic stuff, whatever, there should be no jump in the heart rate. Okay, that is how good your level of analgesia should be throughout the surgery. And a fantastic surgical plane would be where they are nice and ventral, the pupils are nice and ventral, there is low or no jaw tone at all. You do not get a palpable reflex. So none of the surgeons that I work with are allowed to even pinch the animal without me having attained this surgical plane. So there has to be no palpebral, good, no jaw tone and nice ventral pupils, and only then can they touch. Okay, that's like our rule. Obviously, you need good perfusion throughout the surgery, nice pink mucous membranes, good pulse, normal BP, normal heart rate, normal pulse oximeter, good ventilation. Obviously, the dog cat has to have a secured airway. So normal and with an normal entitled CO2, normal capnograph, and normal pulse oximeter reading. Obviously, always connected to an oxygen supply. So this is how it should ideally look in an OT, and we really do try to attain this. This is one of the most tidiest OT, and so that I thought it should be up here. This is Dr. Sanjana at the Progressive Pets Clinic. Beautiful OT, beautiful machines. Love the ventilator. If you can see, I like to. So the patient is nice and relaxed. The surgeon is nice and relaxed. I'm nice and relaxed. It's just like a heaven to work in. So I just want to point out, I like to use some gadgets, make sure that the ECG is connected, capnograph, pulse oximeter. I like all those things. I love all the monitoring, a nice, good anesthesia machine, already checked for leaks, everything, and a continuous rate infusion. And this is something that we're going to talk about a little more today. So how do I achieve these goals? Okay. How do I get them to this nice plane of anesthesia? And one of the most important factors for me is a very good sedation. If they are nicely sedated, the rest of it is just super easy. Okay, so good sedation, good pre-medication, super good pain management, a nice secured airway at all times with oxygen supplementation just gives me a lot of control over the ventilation. And I like to keep the isoflurane or any inhalant anesthetic as low as possible. Any of your inhalant anesthetics are real vasodilators, and they will drop your blood pressure sooner or later. So if you have a dog on like 3 or 4 isoflurane throughout the surgery, you are going to end up with hypotension. So I like to keep them in the nice, sometimes even 0.5 to 2 is the max that I would like to go. And I like them in that range. But how do I achieve this? And this is not possible with a single drug. There is no brilliant one drug that would do it all. And we need to use a combination of drugs. We need to also know which drugs go together, which don't, what are the side effects. And we kind of need to work, with all that in our favor. So let's just learn how to do this. And this is kind of how my anesthesia protocol looks like, okay? So for me, the pre-medication starts at home. So most of my dogs so they just come to the dogs and cats come to the clinic already with gabapentin or trazodone. I love this drug. The dog comes in nice and relaxed, or cat, whatever, comes nice and relaxed. There is no anxiety. They are nicely marinated, perfect for a nice IV catheter placement directly. So it just makes the whole stress and the travel and everything is just so much easier on the dog, easier on the team, easier on the owners as well. So yes, as I said, all of my dogs come in at least with gabapentin plus or minus trazodone. My pre-medication protocol is either dexmedetomidine, butorphanol, ketamine, or aspromazine, butorphanol, or butorphanol and midazolam, especially for sick dogs. I mean, almost all my cats get dexmedetomidine, butorphanol, ketamine protocol. I love this protocol. They just out, and it just is beautiful. You will love it too once you start using it. Induction, I like to use propofol or ketamine like ketofol, and propofol is particularly good induction agent when you're using it with dexmedetomidine. So the dexmed does drop the heart rate a little bit. Propofol is good because it will slightly increase the heart rate. So it's a good combination to use. Sometimes, obviously, we use local blocks, epidurals. We maintain patients on isoflurane or sevoflurane, but mostly isoflurane because that's what is available in most places. And almost all my dogs, unless there is an obvious contraindication, almost all my dogs are on a continuous rate infusion, most of them on dexmedetomidine, ketamine, lidocaine, and plus or minus fentanyl, depending on how painful the whole procedure is. Okay, but this is something I really want to encourage today. I hope. So why do I like dexmedetomidine so much? And I love it for its sedative effects. It's a beautiful sedative. It's a beautiful analgesic. It's though a shorter acting analgesic, but when you use it in combination with, say, opioids or ketamine, it is really long acting. So the effect will last for a couple of hours. The best thing about Dexmed is that you can really reduce even your induction doses of drugs as well as your anesthetic, the inhalant anesthetic doses. So your induction dose can go down by about 30 to 60%, and your inhalant, your isoflurane requirement can go down by 35 to 90%. So this is beautiful. I can actually keep my dogs between 0.5 to 1, one at least, one isoflurane, and they are just beautiful. So how did this dexmedetomidine come into being? And it is, as we know, an alpha-2 agonist with some sedative and analgesic effects. It is basically an enantiomer that has been isolated from medetomidine. So basically comes from medetomidine, just a more potent form of medetomidine, basically. And as I said, it is an alpha-2 receptor agonist. So what are these alpha-2 adrenergic receptors? They both alpha-1 and alpha-2 receptors, mostly in the smooth muscles, and they primarily play a big role in vasoconstriction of the vessels. How does it work? It basically reduces the release of norepinephrine presynaptically in the brain as well as in the spinal cord, and mostly in the centers that are mainly responsible for consciousness and nociception. This is how we get the analgesic and the sedative effect of dexmedetomidine. This is a bit of an important pointer here, that because it stops the release or reduces the release of norepinephrine, if your patient is already very excited or agitated and just already has a high level of epinephrine or epinephrine released, it will take some time for this medication, for Dexmed to work. So you need to give an excited or an anxious dog at least 10 to 15 minutes before you can pre-medicate him with dexmedetomidine. So just let the dog be, or that is why I like gabapentin or trazodone, so that the dog just comes in much more relaxed, or just give it 10-15 minutes and then pre-medicate. Don't just pre-medicate a very anxious, excited dog, because it will take much longer for the drug to work, or it may not work as well, honestly. So how long does Dexmed work? The sedation effect is about 1 to 3 hours. The duration of the analgesia is a little shorter. It's about 15 minutes, but it has this long lingering effect for a couple of hours. And when you potentiate it with an opioid, it will go on much, much longer. Okay. The sedation and the analgesic effect will start to show in like 5 to 15 minutes post the injection. It peaks about at 30 minutes. It's a little bit variable depending on the site of the injection. Sometimes with a lumbar, if you use the lumbar muscles for IM injections, it takes a little longer. Then if you use the thigh muscles, it is probably a little shorter. So it works a little fast. It doesn't matter, just give it time and it will work. So, indication-wise, I think the biggest indication is to use it as a pre-medication. But there's a bit of a glitch here since we don't have access to atipamezole. Okay, if you have access to atipamezole, which is a reversal agent for dexmedetomidine, you can use a slightly higher dose of 2 to 5 microgram per kg intramuscularly. Okay, but if you do not have atipamezole, stick to 1 to 2 microgram per kg intramuscularly. If you go a little higher than that, you might see some cardiovascular effects, which you may not be very happy about. So, yeah, just stay in this dose range if you don't have atipamezole. If there is some way you can beg, borrow, steal, smuggle, whatever, atipamezole, share it between practices, do that. You can just use this drug at a much higher dose. You don't need to reverse them all, but just as an emergency, if you need it, sorry. So for short procedures, it is fantastic. For radiographs, for physical exam, for oral exams, it is a fantastic drug. Just, the dogs will just lie and let you do everything that you need. But the most important use for me has been the continuous rate infusions. And I use this like really almost all my dogs are on a Dexmed CRI. I just love it. At this dose at 0.5 to 1 microgram per kg per hour intravenously, trust me, you will not see practically any cardiovascular effects. You will only get the good out of this drug. So this is a perfect place probably to start using this drug. I also use it as for emergence delirium. So when I have a dog who's waking up a little anxious, who's waking up dysphoric and not very happy, I use really microdoses of Dexmed to nicely, peacefully transition him, nice, good recovery, slow recovery, and they wake up much happier. So some recommendations when I am using Dexmed is just make sure that you have a good fasting. There is a possibility of vomition, when you inject this drug. So maybe about 8 to 12 hour fasting, good eye lubrication, because obviously the palpebral is lost quite early on, or it's at least reduced. So, there's a possibility of the cornea drying up. So make sure you lubricate the eye properly. As I said before, let the dog or cat rest before injecting Dexmed. This will prevent the already present epinephrine or epinephrine from slowing down the whole sedation of this drug. So just let it rest or use gabapentin, trazodone before itself. These dogs, cats are very prone to hypothermia. So keep them warm. Make sure that their temperature stays stable throughout. Now, yes, the part that we hate the most, some side effects that we need to be aware of, okay? There are significant cardiovascular effects because of this drug, respiratory effects. It does cause increased urine production. It does cause emesis. It is metabolized in the liver, and hence caution should be used in at least severe liver diseases. What are the cardiovascular effects? And this is probably the most important thing that you need to understand about this drug. Now, what happens with this drug is it causes significant peripheral vasoconstriction. Because of this peripheral vasoconstriction, there is a significant hypertension that is caused, like a systemic hypertension. The heart rate drops because of this sudden hypertension. So it's like a reflex bradycardia. You understand? So significant vasoconstriction causing hypertension, causing a reflex bradycardia. So the drop in the heart rate is only because the blood pressure is very high. And dogs seem to be more sensitive to this vasoconstrictive effect. Now, this effect kind of is like a ceiling. The cardiovascular effect is a bit of a ceiling effect at 2 to 3 microgram per kg. Okay, when you use this drug at 2 to 3 microgram per kg, you can see the cardiovascular effects. And they're not very different even if you use it at 10 microgram per kg. So it is not dose dependent. So whatever you will see at 2 to 3, whatever cardiovascular effects you will see at 2 to 3 microgram per kg is what you will see at 10 microgram per kg. But understand that the drop in the heart rate is a reflex because of a significant shoot in the blood pressure. So what all arrhythmias do you see? You see like just a drop in the heart rate, like a sinus bradycardia. You can see first and second degree AV blocks. You can see a sinus arrest as well. Okay. Now what happens with, like, obviously it's a bit of a panic situation, but how do you treat it? Can you use atropine? And the answer is really no. Okay. The reason being that your heart rate has dropped because of a significant hypertension. If you use atropine to increase the heart rate, you're going to cause a lot of stress to the heart. An already hypertensive dog with a really high heart rate is a bad combination. Okay, you might end up causing even more hypertension, which might cause some end organ damage, like in the brain, in the retina. So it is important to understand that we cannot use dexmedetomidine concurrently with atropine. So it is absolutely contraindicated to use these two drugs concurrently. Okay. What can you do? There is a reversal called atipamezole. Okay. Now this drug reverses the effects of dexmedetomidine. It can be used intramuscularly. Do not use it intravenously unless you have an absolute cardiac arrest. You can use it at a dose of 0.1 to 0.3 mg per kg. Okay. Or even lower than that is okay. Unfortunately, not currently available in India, but if you are able to in any way just get hold of it, not to use it routinely, but just in an emergency situation, it is great. So what about me? I do have this drug, but do I reverse all my patients? No, absolutely not. I love dexmedetomidine. I love the effects that it causes. I love the analgesic effects. I love the sedative effects, and I do not want to reverse my patients. So the problem with atipamezole is it will reverse my sedation as well as the analgesia. So sometimes I just want the sedation to be gone, but it will also reverse the analgesia, which is not going to be good for the dog. So if you ever have to reverse, you have to make sure that you add on some analgesic before you reverse it. Okay, and if need be, just reverse it partially. So what do you do if you do not have atipamezole? Okay, basically just use lower doses of dexmedetomidine. As I said before, dexmedetomidine at 0.5 to 1 microgram per kg per hour has no cardiovascular effects practically. You will love it at this dose. So I would absolutely recommend trying this. Use it in a continuous rate infusion. and you will love it. You can use it intramuscularly at 1 to 2 microgram per kg, and you will be happy about that as well. So just basically use lower doses if you do not have ATPAMs. So what do you do if there is bradycardia and if you still don't have atipamezole? Now, I hope you've taken my recommendation seriously and used lower doses of Dexmed if you do not have atipamezole. Okay. If the heart rate drops, make sure you check the blood pressure. If your mean arterial pressure is above 80 mmHg, just relax. And that is mostly what is going to happen. Even though your heart rate drops, mostly you will have a normal or a high normal blood pressure. If that happens, just relax, wait it out. You know, the dog is just going to be fine. There have been some reports, actually just one paper where they've looked at using lignocaine IV at 2 mg per kg for reversing the bradycardia. I haven't used this, so I'm not going to recommend this, but there is some literature that is available. A little more research probably needs to be done with this before we can, recommend. What if it is more than 30 minutes since you've given Dexmed and you have a low blood pressure? That is the only scenario when it is okay to use atropine. So if you have a pressure that is less than 80 mmHg, mean arterial pressure, and it has been more than 30 minutes since you've given the Dexmed, it is okay to use atropine there. But that is probably the only situation. Otherwise, you should not use dexmedetomidine in combination with atropine. So it does have a little bit of respiratory side effects as well. It does reduce the respiratory rate and does increase the tidal volume a little bit. But it's not good for respiratory patients in general, and particularly those with pleural diseases. What happens in cases of pleural diseases like pleural effusions or some masses or something, the dog or a cat tries to maintain its ventilation by increasing the respiratory rate. So if you try to reduce the respiratory rate, it's not going to be able to ventilate to it. So if you see, they're generally like constricted, shallow breaths, but more number of breaths, so tachypneic. These patients are not good candidates for Dexmed. The reason I'm telling you this particularly is because generally you need to tap a dog or a cat with pleural effusion and you just need a short sedation. And you would like to go for something like Dexmed, but it's not a good idea. Use something much that has less of respiratory effects, maybe like some opioid, butorphanol. It does increase during production, so there is some diuretic effects. So especially for long surgeries, I like to put like a urinary catheter in these dogs. It is contraindicated in patients with urinary tract obstructions. So why not use xylazine instead? And the reason being that there has been a report of increased mortality in dogs that have been given xylazine in their anesthetic protocol. They are prone to more arrhythmias. They are prone to more arrhythmias in combination with isoflurane. It's also a non-selective alpha agonist. So it does cause massive hypertension followed by massive hypotension. Okay, and we have used a similar drug, so why not use a better drug? And Dexmed is just much more potent, much more safer than xylazine. So who gets dexmedetomidine as pre-medications? I like dogs and cats that are healthy. SAA grade 1 and 2 anesthesias are perfect for these dogs. But I use almost all my dogs will get continuous red infusions of dexmedetomidine. So some of the contraindications for Dexmed are you can't use it in dogs less than 16 weeks and cats less than 12 weeks. The reason for this is that young dogs and cats, they depend on their heart rate to maintain the blood pressure. So if you drop their heart rate too much, they will be unable to maintain their blood pressure. So you cannot use it in young dogs and cats. Obviously, dogs and cats with cardiac diseases, you should refrain from. Bradycardias, hypotension, hypoxia, severe liver disease, shock, and respiratory disease. It does affect the uterine blood flow, so do not use it in pregnant animals and in C-sections. So the use of Dexmed is a little controversial. in some of these cases. So I would say avoid pre-medication, but maybe CRI is okay. There have been reports, there have been suggestions to use cats with hypertrophic cardiomyopathy to use Dexmed in these cases at low doses at 0.5 to 1 microgram per kg. The reason being the slightly resistant vasculature will increase the left ventricular filling pressures because it will just keep the left ventricular outflow tract slightly open and just, there'll be better filling of the ventricle because of this. So it is recommended to use it in at low dose 0.5 to 1 microgram per kg in cats with HCM. I have been using this, but as I said, at low doses. Okay. In urinary obstructions, it's not okay to use this drug maybe just to do a cystosynthesis in these cases, but if you're relieving the obstruction, it is okay to use the drug. There is going to be diuresis, so you have to be prepared to deal with the diuresis. There might be some post-obstructive diuresis anyway, prepared to deal with post-obstructive diuresis and some Dexmed diuresis. Kidney disease, honestly, I use it if it's not too bad of a kidney disease. It doesn't cause too much of a renal issue. In humans, it has actually been used to prevent acute kidney disease, acute kidney injury. So there have been reports about using this well enough. Sick dogs and cats, I do not use this as a pre-medication in sick dogs and cats, but I do use it as a continuous rate infusion. I've been using it in all kinds of big surgeries, including thoracic surgeries, lung lobectomies, liver lobectomies, adrenalectomies, any nephrectomies, any of these surgeries, I do use this as a continuous rate infusion. It just makes it just reduces my isoflurane significantly, and it just makes the whole anesthesia very beautiful. Everybody is very relaxed, and I like that. So how about Dexmed in cats? It's amazing. It's amazing. This is just one drug that I love for cats because I was struggling quite a bit before we had enough, access to Dexmed. I've been using the human one, and now I'm glad we have this to use the veterinary one instead. So I love the combination of ketamine, butorphanol, and Dexmed. You can use it IM, you can use it IV. I love this combination. The cat is just out and it's beautiful. Then absolutely helpless situation. Dexmed does work transmucosally as well. So you can actually just squirt the entire kitty magic in the cat's mouth as it hisses at you in an absolute worst situation. But it will work. It will get absorbed. You might have to just wait for like half an hour. So if nothing else, I really want you to take this information home. I want you to try and use continuous rate infusions as much as possible. You can use it with pediatric sets, or you can use it in syringe pumps, whatever, doesn't matter. Just do it. I use it in combination with ketamine, lidocaine, fentanyl, and obviously dexmedetomidine. All micro doses, ketamine at like 0.5 to 1 mg per kg, lignocaine at 1 mg per kg, fentanyl at 2 to 5, but I started 2 microgram per kg per hour, everything per hour. Okay, and I love this. Just a quick summary on the whole thing. Do not use atropine and dexmedetomidine concurrently. It is contraindicated. The bradycardia that you see with dexmedetomidine is secondary to a sudden hypertension. Okay, do not stress the heart. So do not use atropine and dexmed concurrently. In pre-medication, if you do not have atipamezole, use it at 1 microgram per kg intramuscularly. If you have atipamezole, you can use high doses at 2 to 5 microgram per kg intramuscularly. And this is just, you don't need to reverse this, but just in case of an emergency, you have a drug. Continuous rate infusions at 0.5 to 1 microgram per kg per hour intravenously. Try this. You will love it. You will not see any significant cardiovascular effects at this dose. The good thing about, so all these years I was actually using the ampules, and they, I think one costs about 1 ml would cost about 300 to 400 bucks, or I don't remember exactly now, 600, I don't remember. But they were like 1 ml ampules that I used to get, and I had to throw them away after every single use. I'm glad we have it in a vial form, so it's going to be much more economical now. All right, so this is a little bit of a peek in my life. My husband, Prathamesh, and myself, we enjoy trekking. And over the years of trekking, we realized that the more prepared we are, the more we enjoy the whole process. And that's kind of how dexmedetomidine is. The more you understand this drug, the more you learn the rules, how to play with this drug, you're going to enjoy the drug more. Okay. I hope you know, this was helpful, and shoot your questions.
Thank you so much, Dr. Dipti. So I think we have a few questions. The first one is from Dr. Nirali.
Sure.
Would you choose Dexmed to sedate a patient for a cardiac exam?
Sorry. Yeah. Can you just repeat the question, please?
Would you choose Dexmed to sedate a patient for a cardiac exam?
Never. Never.
Okay.
So the thing with Dexmed is it does have significant cardiovascular effects. Okay. So I will never use it, even though it is reversible, I will never use it to assess the cardiovascular effects. Assess the cardiac function overall. The reason being, it is going to cause changes in the heart. Okay, when I do my echocardiography, when I do the measurements on echos, it is going to change just because I have used dexmedetomidine. It will change my heart rate, it will change my pressure, it will change my internal velocities, the aortic and the pulmonic, everything. So it just doesn't make sense. My exam won't be good. Secondly, I don't know what I'm dealing with before I do an echo. So, you might just get in a very, very tricky situation there. So use drugs that have the least cardiovascular effects. Something like butorphanol would be great. Okay. Just start with that and see how it goes. I have used it sometimes in a CRI, even in cardiac patients, but it is very individual. Cardiac patients are just one thing you need to be really careful about with Dexmed.
Okay, thank you. The second question is, what is the dose of ketamine, butorphanol and dexmedetomidine combination for CAT?
Okay, ketamine, butorphanol and dexmed. So ketamine, I sometimes use it IV. Okay, so my dexmed dose is at 1 microgram per kg. My ketamine dose is about 2 if I use it IV. You can go up to 3 to max 5 mg per kg if you're using it IM, and butorphanol is at 0.2 mg per kg.
Okay. The next question would be, how many hours fasting minimum would you recommend for using Dexmed?
Yeah. So that's the thing. There has been a recent change in the recommendations for fasting. Now they do not want you to fast your patient for too long. But the Dexmed fasting, if you're using it at like proper Dexmed doses, which is like 2 to 5 microgram per kg, they still recommend about 12-hour fasting. Now, I think they recommend about 6 to 8 hours or even lesser fasting intervals in dogs and cats, I think. But in Dexmed, they are still recommending slightly longer fasting if you're going to use it at 2 to 5 micrograms. So if you're using it at a lower dose, I think you should be okay. I haven't seen any vomiting at 1 to 2 microgram per kg. So it should be okay, even if it's lesser fasting.
Okay, so in the same question, it was, say, a small cat and a large dog. So
yeah,
the answer remains the same.
Sure. Honestly, I don't see any vomiting in cats with Dexmed. I think, yes, you can just absolutely go ahead with the normal recommendations for your small cat. I don't know how much you're fasting now. Every surgery, they kind of say it a little differently. But if it's a small cat, maybe don't do it more than 4 hours, because you will end up with some hypoglycemia and all those issues. Big dog, I don't think it matters. I don't think size, maybe a little bit, maybe 6 to 8 hours for a dog. But yeah, I haven't had issues with cats vomiting at all with Dexmed.
Okay. The next question is from Dr. Samriddhi. Ma'am, dose rate of Dex in Kitty Magic, and can it be used for OVH?
Oh yes, absolutely. Kitty Magic dose of Dex is still for me 1 to 2 microgram per kg. That hasn't changed. Same dose. Absolutely love it in OVH. You will love it. Believe me.
Okay. We have Dr. Arumoy with a doubt. Can I use this with combination of tiletamine plus zolespam?
They have recommended it. Honestly, I don't know why you would want to come. The reason being, it is just going to end up with a very long anesthesia. So the advantage of Dexmed is it is shorter acting. It's about 1 to 2 hours. If you combine it with ketamine and butorphanol, say, you will still have a maximum of 3 hours of anesthesia. With tiletamine and zolazepam, your anesthesia time is going to be much longer, unless you're doing a really long procedure, like say something worth 3-4 hours. I think, I mean, in that situation, absolutely you can combine Dexmed and tiletamine and zolazepam. It also does help in terms of the heart rate in those situations, but not a significant advantage of combining those two drugs. I would rather combine it with ketamine and butorphanol. Yeah.
Yes. The next doubt is from Dr. Tribhuvan. Ketamine and diazepam doses if I use Dex, and any pre-analgesic recommendation before surgery?
So you're using, sorry, can you just repeat the question?
Ketamine and diazepam doses.
Yeah.
If I use dexmedetomidine, that's the
Yes.
first. And is there any pre-analgesic recommendation before surgery?
So what I generally do is either our prep time is quite long. So I end up using butorphanol just for the initial bit for the sedation. And once the prep is done, butorphanol, Dexmed, whatever, and then once the prep is done, I actually give them fentanyl for pain management. And I keep them on fentanyl CRI throughout the length of the surgery. And then once they're waking up, they either have a fentanyl patch or buprenorphine, either of it. The ketamine and midazolam dosing, it will depend on the sedation. It will depend on how sedated the dog is. I mean, you might end up using really even half the dose of what you've been using all these days, or even 1/3. It is a little bit of to effect kind of a situation there. So plan for half the dose of what you generally give and see how it goes. See if you're able to intubate. If not, give a little more till you're able to intubate. There is no obvious dose to that, but you wouldn't need more than even 1 to 2 mg per kg, 1 mg per kg of ketamine if your dog is nicely sedated. So it all depends on how nicely sedated your dog is.
Okay. Dr. Sanjeev is asking, hi, Dr. Deepti, can we use Dex to induce vomiting in a cat, as apomorphine is contraindicated in cats?
I wouldn't, because the cat will sleep in like no time, and then you have a sleepy cat who's trying to vomit, and no, you might get into a very tricky situation there. Avoid.
Okay. Dr. Supriya has this question. Ma'am, do you use CRI in all type of surgeries or just in case of longer surgeries?
No, I use it in space as well. I like it. I just love it. I mean, anything that would reduce my isoflurane. So I use it in space quite routinely. I think except for castrations, I use it in everything.
Okay. Dr. Komal has this question. Can we use Dexmed in dilution for top up while dog or cat is under isoflurane maintenance?
Yeah, absolutely. Absolutely. If you have not pre-medicated, the dog with Dexmed, and yeah, you're not doing a CRI, you can use it intermittently. You will see some beautiful effects under anesthesia. So the moment you give Dexmed to a dog, and if you have like a Doppler already placed on the dog, and you can hear the whoosh whoosh, you will hear the whoosh whoosh go away a little bit, or at least reduce in volume. Don't panic. This is just the peripheral vasoconstriction in action. It will get better. You don't need to do anything. The pressures are probably going to stay normal. But yes, you can absolutely use it intermittently, and it will help you with your anesthesia.
Dr. Raj is asking, in a fractious pet before meditation with dexmedetomidine, what do you use?
As a pre-medication, even before they come to the clinic, is that the question? I think that's the question. Let me answer that. So so for me, the pre-medication starts at home. I get them in the clinic with gabapentin and trazodone if it's a really fractious dog. And once the dog comes to the clinic, I give it a couple of minutes, and I use a combination of the same kitty magic. I use it as a doggy magic. So that's the combination of dexmedetomidine, butorphanol, and ketamine. One shot, and the dog is out.
Can Dexmed be used alone in procedure like CT scan and MRI?
Well, you don't have good monitoring, at least in the MRI. So you are going to get in a situation where you use Dexmed and you don't have good monitoring. You don't know the blood pressure because you cannot take any machines inside, and then you don't know the blood pressure, and you may have like a arrhythmia and you don't know about it. Dexmed is not a drug that you should leave alone. You should be monitoring this drug continuously. So I would say no. Dexmed alone for either CT or MRI means you need to give really high doses of Dexmed, which is okay if you have atipamezole. If you do not have atipamezole, do not use these drugs alone. Use it in combination. It's going to make your anesthesia much more safer. In the clinic, maybe if you're doing some radiographs, you can use it, spinal radiographs. I think you can just give some Dexmed and maybe even some butorphanol Dexmed combination and get the radiographs done. And then reverse the dog. That is generally how this drug is used in other countries. They give dexmedetomidine, get the radiographs done, and they just quickly reverse the dog. So the dog just basically goes back home walking. But if you don't have the reversal, then you are in a situation where you have a very anesthetized dog, very sedated, and it will take forever for this dog, not forever, but 1 or 2 hours for the dog to wake up, and you might still have some cardiorespiratory effects. So if you don't have the reversal, I would not recommend. If you have the reversal, maybe CT is okay, where you can monitor. Maybe radiographs are okay, where you can monitor. MRI, I would be careful, because already with, say, a brain lesion or something, if that's the reason for your MRI, you might already have bradycardia. So with like a increased intracranial pressure, your heart rate, there's like a Cushing's reflex, and the dog already has a little bit of bradycardia, which might make it worse. So MRI avoid. CT radiographs may be okay with atipamezole.
Dr. Subir Bhattacharya has been asking, do you recommend peritoneal route for Dexmed in any case?
In what? In what?
Peritoneal route.
In? Oh, sorry. In just peritoneal route? No, I don't. I've not tried it actually, and I haven't even come across this recommendation. I can read up a little more about it and let you know.
The next question is, say you've had to reverse Dexmed sedation while the patient got bradycardia. How
Right.
do you manage that? Would you use something else?
Sorry, the question was, how do I reverse it, right?
Yeah, the patient got bradycardia. How would you manage that? Would you use something else? And in a situation where you have to do the surgery, would you suggest to go up on the ISO and keep sort of a semi-TIVA protocol with intravenous?
Yeah, sure, good. So if I have to, so if I have a situation where I have a dog that I have pre-medicated with Dexmed and the heart rate drops to say 40, and I do see some AV blocks, I do see some ventricular premature complexes and things like that, okay? And the ECG is not nice, I'm not happy, I want to reverse this dog. I will attempt to first partially reverse the dog. So use it at half the recommendation. So maybe instead of 0.1, maybe go at 0.05 mg per kg of the reversal. See what happens. If the heart rate improves, great. If the heart rate doesn't improve, completely reverse the Dexmed.
Okay.
Obviously, most of the times, unless it's a very elective surgery, you want to still go ahead with the surgery, right? Because there is a reason why you're doing that. So I would then slightly change my protocol. If the dog is this, if this happens in the pre-medication phase itself, maybe I would add a little more of butorphanol, go higher on the dose of butorphanol, plus or minus, maybe use a little bit of midazolam, give ketamine propofol as my induction dose, intubate the dog, put the dog on isoflurane, and maybe use ketamine lidocaine CRI and continue with the surgery. Don't use Dexmed, withhold Dexmed anymore, but use ketamine, which will slightly increase your heart rate, lidocaine, which will keep it okay. And that should manage, and you can add some fentanyl as well, that way you can drop your isoflurane. I hope that is helpful.
Okay. Dr. Chandrasekhar is asking, prior atropinization with alpha-2 mandate.
There have been some recent papers that have recommended that. But the problem with that is then you have no control over anything. So you've already given atropine, and then you've already given Dexmed. And then what if you end up with a situation where you have a high heart rate and you have a high blood pressure? It's a little tricky to recommend that. Hence, I do not. Hence, I would just recommend going lower on the Dexmed doses. But it is absolutely contraindicated to concurrently give Dexmed and atropine, or give atropine after you've given Dexmed. Before is still gray, but it's a very tricky situation that you are in, where after some time, if you have a high heart rate and a high blood pressure, you are stuck.
Okay. The next question is, what is the significant difference between xylazine and Dexmed?
So it's just a much more potent drug. Xylazine, Dexmed, xylazine is not so selective. So it will cause, it also has been doing this. Xylazine also has been causing massive hypertension followed by massive hypotension. And if you observe, whenever you give xylazine, the heart rate does drop. If you check the pressure, then you will notice that it does behave very similarly. This is just a much more safer drug than xylazine. And that's the only reason we should shift to this. Also, xylazine is prone to many arrhythmias, which have been related to a high mortality. There was a study that came up just showing that having xylazine in your anesthesia protocols seem to have increased the mortality rate quite significantly. I don't remember the exact numbers, but that was a significant increase in the mortality rate just because you had xylazine in the protocol. And this is and not with Dexmed.
Okay. Dr. Subir Patsaria has been asking, can you enlighten on the use of Dexmed in exotic animals?
Oh, I don't do exotics, but we recently had, I do some anesthesias for Dr. Nupur, and they recently had a radiation that they did for a rabbit. And that rabbit needed like almost 5 anesthesias back to back. And I remember them using some Dexmed in those situations. So yes, it can be absolutely used. I don't do exotics, but I can ask somebody and I can just send some references on that.
Okay. This one doctor asking, could you please repeat the Kitty Magic dose?
Yeah. So Kitty Magic, ketamine at 1 to 2 mg per kg, butorphanol at 0.2 mg per kg, and dexmedetomidine at 1 to 2 microgram per kg.
Okay. And we have Karma Foundation here. So their question is, what's your usual go-to anesthetic protocol with Dexmed for a regular spay neuter procedure and orthopedic procedure?
So yes, I like the combination of Dexmed, ketamine, and butorphanol. IM, if I give it. I can then induce which needed after I have used ketamine in the pre-medication. And then I maintain them on isoflurane. I also might keep them on a CRI of ketamine, lidocaine, fentanyl. Maybe not Dexmed if I've used it in the pre-medication. Sometimes I don't use it in the pre-medication. I use aspromazine, butorphanol as my pre-medication, induced with ketamine and propofol, maintain on ISO, keep the CRI of Dexmed, ketamine, lidocaine, and fentanyl combination, and do some local blocks.
Okay. The next question from Dr. Janak is, Dexmed reversal agent from where can you buy?
Sorry?
Yeah, can you hear me? Join from this.
Yeah, now I can hear. Yeah.
From where can you buy Dexmed reversal agent?
Yeah, good question. Beg, borrow, steal, smuggle. Wherever you get it from. Sometimes we have had friends who are traveling abroad, and if they can get you some, share it within a practice. Or yeah, it's tough, but I don't know, maybe Vivaldis can help.
Yeah, sure. Yeah. Yeah. The next question is from Dr. Annie Varghese. Could you help to get in touch with suppliers of gabapentin and trazodone and fentanyl?
So gabapen and trazodone, you can just use the human one. So they can just go to a human pharmacy and pick it up. That should be okay. Fentanyl, what we have been doing is we need to send the owner sometimes, or the owner with a triplicate prescription with your stamp and the owner's details to a big hospital, and they can get it on a triplicate prescription with your stamp in it.
Dr. Mohan Deshkar is asking, can you please repeat the dose combination for dog magic? Doggy magic.
Dog magic. Doggy magic, I would use at maybe slightly higher doses for doggy. So 2 to 5 max mg per kg. 2 to 5 is okay. And Dexmed at 1 to 2 microgram per kg.
Okay. The next question from Dr. Armoy is, can I use Dexmed in emergency C-section?
No, you cannot, because Dexmed will cause, it will obstruct the uterine blood flow. So can't be used in C-sections.
Okay. The next question is there a need of muscle relaxant with doggy and kitty magic?
You don't actually. It's a beautiful muscle relaxation that you get. If you need to get more muscle relaxation, maybe you can add some midazolam. That should help. Your isoflurane is also a beautiful muscle relaxant. So after you've done all of this, I think you should get decent muscle relaxation. But if you don't, maybe just add some midazolam.
Yeah, Dr. Pritesh is asking, what's the dose of trazodone?
I use it. So max, I use it at 3 mg per kg. You can go much lower than that, depending on how your dog is. If you have a really crazy dog, crazy aggressive, maybe do it at 3. I use it in combination with gabapentin. So I use gabapentin at maybe 10 to 20 mg per kg, depending on how crazy the dog is. Trazodone, maybe from 1 to 3 mg per kg, depending on how crazy the dog is. And I use it in combination. So everybody gets gabapentin, trazodone maybe plus or minus.
Okay. Do we have any more questions, or if any of the doctors wish to join the session or would like to talk or have a discussion, you can please type on the chat. We can allow access. Do we have any more questions? Yes, so we have one question from Dr. Nitin. Is gabapentin and trazodone combination enough for examination in fractious dogs?
I mean, it depends on what you're trying to examine. If you're trying to examine the oral cavity, maybe not. If you're trying to examine the butt, maybe yes. So if you can get with this combination, maybe gabapentin at 20 mg per kg and trazodone at 3 mg per kg, a very, very, very fractious dog will allow you to muzzle or pull. Okay. So you should be okay dealing with anything other than the face maybe. If you need something more, I think the dog should be quite knocked out for you to at least place an IV catheter and give something more if need be. I've been really happy with this combination.
So Karma has been asking, can we have the recording? So yeah, to selected doctors who would want this recording, to those who have attended today, we will be able to share it. Yeah, the next question is, would you be concerned with using Dexmed in a patient with a seizure history?
So what happens with brain? So it's a very good question. So Dexmed is known to have some neuroprotective effects. But the problem that can arise is that with a brain condition, say anything, seizure, circling, whatever, if there is an increase in the intracranial pressure, there is something called as a Cushing's reflex. The Cushing's reflex is basically like a hypertension resulting in a low heart rate, very similar to how your Dexmed also works. Now, if you give Dexmed, you might actually increase the hypertension and further decrease the heart rate. So most of the dogs with increased intracranial pressure have a low heart rate. Okay. Now that makes it very tricky for you to give Dexmed in those situations. It is not something that you need to completely avoid, but you need to be very careful while doing this. Sometimes, so it's a tricky question. I would say withhold unless there is no other option. Yeah.
Okay.
You use something else unless it's a really crazy Fraxis dog and there's nothing you can do, but avoid it as far as possible.
Okay. Dr. Disha is asking, gabapentin and trazodone, is it the same dosage for cats?
Yes.
Okay.
Trazodone, I would go even lower in cats, I think. I would go 1 maybe. But I don't use trazodone so much in cats. I just the GABA at, honestly, if I use GABA at like 20, the cat is beautifully out. But dogs don't sleep so much with GABA, so I need to add some trazodone.
Okay. Dr. Pritesh is asking, why not stick with opioid, benzodiazepine, ketamine-like combinations for maximum cases if their cardiopulmonary effects or overall side effects are less compared to Dexmed combinations?
What is the combination that you're recommending?
Opioid, benzodiazepine,
and ketamine. Yes, I like this combination, and this is kind of what I stick to for most. Unless in hypertrophic cardiomyopathy, I sometimes like to use Dexmed. There has been a good positive effect in cats with Dexmed, and that's the only reason why I would use that. But yes, this is kind of how I like to do most of my cardiac patients. Is this for cardiac patients or just in general? So he's asking combination for maximum cases if they're, sorry, what's the question? I lost it.
Yeah, so that was the previous question, which you...
just because it has less cardio. Oh, so this is for routine patients you're asking me. Because it is a beautiful drug. And honestly, with opioids, benzodiazepines, and ketamine, you might be okay for about a surgery that is just 15-20 minutes. If you're doing longer surgeries, you need to really work on your isoflurane doses. So you might end up giving a huge amount of isoflurane if you don't add anything to this. It won't be enough for a long, say, orthopedic surgery or anything. Also, the pain management, unless you're using fentanyl, is not good in this combination. So if you use Dexmed with this combination, your opioid will work for a much longer time as a pain med, as an analgesia. And benzodiazepine, if the dog is not sick, does not give you enough sedation. So this protocol is great for a dog that has a heart issue because they will sleep with an opioid, benzodiazepine, and ketamine. But if you have a very active dog, the dog won't sleep very well with opioid and benzodiazepine. The sedation won't be that nice. You will, benzodiazepine especially will be very, they are very reactive dogs sometimes. So you might have issues with the sedation itself, also analgesia, because you may not have enough of it.
Yes, there's one more question that has come up. Would you worry about using kitty magic, doggy magic in a patient with increased intracranial pressure for any reason? The ketamine at that dose, would that cause any issues?
It can. Yes, it can. I would worry. I have seen, yes, that can be a problem. Avoid it in dogs and cats with increased intracranial pressure. You should use something else. Maybe most of the dogs with such a horrible intracranial pressure would be very sick. So you may not need to use too much of a pre-medication. So maybe just opioids and a midazolam, any of your benzodiazepines might be enough as a sedation. And then you can use maybe propofol, ketamine. Should be. No, sorry, propofol, again midazolam for your induction might be okay.
And the same doctor has been asking, have you noticed any breed-specific reactions with Dexmed? Are some breeds more predisposed to having issues with Dexmed?
any breed that is more predisposed to having vagal issues will have more bradycardias. So any of your pugs, your snub-nosed dogs, they inherently have slightly lower heart rates. So they can, heart rate can further drop because of Dexmed, and that can be a little bit of a problem. Also, ventilation can be a little bit of a problem if they are too sedated with the Dexmed. Uh, but at lower doses, 1 to 2, if it's a Fraxis dog, especially lower doses 1 to 2, you should be okay. CRI is absolutely okay. I have not had any breed related issues with the CRI dosing at all.
Okay, so I think we are done with the questions. So yes, like a lot of doctors have typed here. Thank you, doctor, for this such a great presentation. And also you've answered a lot of our questions and a lot of doubts which most doctors had. And I think if anybody has more questions, they can reach out to you on your email.
Absolutely. Absolutely. Just drop me a mail and reward.
Okay. So yes, I think we will wind up this session here. And once again, we are reminding Vivaldis has come up with dexmedetomidine injection with the name of Dextasia. And it's available in a 10 ml vial form, multi-dose vial. Like doctor said, most other human brands have been coming up with ampule form of 1 ml or 2 ml. So we always try our best to bring more products which are veterinary specific and is dedicated to the veterinary community. And which is why we have launched Dextasia as a multi-dial dose form with at an economic rate. And I'm sure our sales team has been meeting all these doctors. So y'all can always reach out to them for any doubts regarding the pricing or if you want more information. So yes, Dr. Deepti, thank you so much for doing this with us. And we look forward to doing more sessions with you as well. And
thank you so much. Thank you so much, Vivaldis. Thank you for coming up with Dexmed. It's a beautiful drug. I hope I've only encouraged everyone to use it.
Yes. Yes, doctor. Thank you so much. Yeah. And all the other doctors who have taken out their precious time to join this webinar, we thank you all as well. And yes, thank you. And we'll be sharing the recorded session to the doctors who need it, and especially only to those who have attended the session today. So you all can reach out to us at the same mail ID I had shared the invitation. Yes. Thank you. Thank you, doctor.
Thank you. I'm going to stop sharing.
Yes.
Thank you.
Yeah. Thank you, doctor. Yeah.